This is another one of my many mature intumescent cataracts for phaco. Putting a 2.8 millimeter incision initially and my two side port incisions. I then, after staining the capsule with trypan blue, go ahead and create a capsular excess with my cystitone, which is a bent 26 gauge needle. So this is a fairly straightforward cataract. And that's more than adequate or excess. Once done, I go ahead and hydrodissect nucleus. It has come forward, I know it is released, I rotate it and then go ahead to proceed and do the direct vertical chop on it. I have taken a very sharp chopper in my left hand, as you can see, and I will be performing the woodcutter's technique. And you can see, first I impale the nucleus from the mid-peri towards the center, then again impale with my chopper in the mid-peri opposite end, engage phaco and go towards the chopper, and then laterally separate when both the instruments meet. And this I will do for at least 4 or 5 fragments, if not more. Sometimes I just do the quick chop for some of the fragments. It depends on how hard the nucleus is. And usually I use the chopper and or the phaco tip to rotate the nucleus to get the pieces into alignment or for better access for chopping or removal or whatever. I've got one heminuclei done with 2 fragments. Now the other heminuclei I'm going to chop it, and that's a quick chop, as I just mentioned earlier. And now that I've got my fragments, it's time to remove them. I usually don't bother to go into pulse. I just take out these fragments with the continuous power itself. And you can see the iris is a bit floppy. It has prolapsed through the paracentesis. And I'll just push it back. However, it will have some damage. Push it back with my Sensky hook. I've changed the chopper for a Sensky hook. And see how I attack the attachments to get at the apex of these fragments. Once you do that, it's very easy to emulsify and remove these fragments. And that will keep prolapsing. Now I take my bimanual in an attempt to remove the cortex. This is not a pretty sight because this has formed a bowl. So you can take out a bits and pieces there, but most of it will remain as a bowl, and the more you try, the bigger the bowl you create, or the more inaccessible bowl that you create. And sometimes I do this, I just see it's rotating, so it is separated. I just put off my vacuum and see what I do. I just rotate to see whether it will come, otherwise I just go under it. Okay. The irrigation is on and nothing else is on. Go under it and pull the whole plate into the AC. But this has to be done very carefully. If you by chance engage vacuum, you may catch the posterior capsule. So you have to be very careful. See, I am doing it again. Once you get under it, it's very easy to aspirate that whole piece. There you have it. Just making sure I clean the cortex completely. Don't be aggressive with these cataracts. Frequently the zonules are weak. You think you have a big chunk of cortex, it's actually the bag that is coming out. So you have to be very careful and see what you have got. Confirm and then only pull. I can show you several cases where, see this, like this, it just comes and you really do not know whether you have got just cortex or cortex and the bag. Anyway, in this case everything went off well. I go ahead and place my single piece foldable IOL within the bag under HPMC, clean up the anterior chamber of all HPMC and conclude the surgery. Thank you.